Ankle pumps. Lying down on your back or sitting in a chair, pull your toes up toward your head, then point your toes down. This exercise will help to prevent blood clots and can help reduce swelling. Do this exercise with both ankles at the same time and repeat it 10 times every hour. Don't hold your breath while doing this exercise.
First, identify your ASIS and tighten your core. Continue by pulling your heel to approximately 90 degrees towards the rest of your body, then return your leg to an extended position. You may release the tension in your core before tightening again and bringing your opposite foot toward your body and repeating the process. One repetition includes pulling each heel towards your body one time. Complete 3 sets of 10 to 15 repetitions. Between each repetition, you may relax your core, making sure that you're breathing each time. If this is uncomfortable and you are only able to move your heel a certain distance before discomfort, stay in the range that is most comfortable for you but is still challenging.
Short arc quad. Begin by lying with your affected leg straight out in front of you with a foam roller under your knee. The unaffected knee should be bent and foot should be flat on the ground. Slowly raise the leg into full extension with toes pointed up. Hold for 5 seconds and breathe. 1, 2, 3, 4, 5. Slowly lower the foot back to start position. This position puts stress on the ACL and should not be performed early in an ACL injury or reconstruction. Do 2 sets of 10 repetitions on each side twice a day for 5 days a week.
Begin by lying on your back and placing your feet on the ground, creating a 45-degree angle with the knees, hands by your sides, tighten your core, bring your hips up to create a straight line between your knees and your shoulders. Hold this for 3 to 5 seconds, then relax by returning your pelvis to the ground. Tighten your core and repeat. Complete 3 sets of 10 to 12 repetitions. It's important to maintain correct posture and not let either of the hips dip down or rotate from side to side. If you are only able to do this for 2 seconds, that's fine. Good posture is important. If you are looking for something more challenging, you may cross your arms across your chest and complete this exercise. Again, maintain that straight line from the knees to the shoulders. Tighten your core before each repetition, and again completing 3 sets of 10 to 12 repetitions. If you need a less challenging exercise, you may extend the arms straight out to the sides and complete this exercise. This will provide more support and stability side to side and allow you to complete this exercise with a little less demand. Remember to keep the core tight for each repetition and take a moment to relax in between. Begin by drawing your core in. Raise each leg to approximately 90 degrees of hip flexion. Hold it for 3 seconds before returning it to the ground. 1 repetition includes raising and lowering each leg 1 time. Complete 3 sets of 10 to 15 repetitions of this exercise. Keep in mind the core should remain tight and engaged throughout the movement of each leg. If you experience any discomfort in the back with this exercise, you may discontinue or preferably stay in the zone or range of motion that is comfortable and doesn't cause discomfort.
This is a great exercise to help promote rotation of your hip, your knees, and your trunk. It also reduces stiffness through your spine and can help assist with rolling over in bed. To perform this exercise, you're going to lay on your back. You're going to keep your feet and knees together. From here, you'll twist, taking your knees to the ground as far as you can, ensuring that your knees stay together through the entire exercise. You'll come back up to center and rotate to the other side as far as possible. If you have difficulty keeping your knees together, ask for assistance from your caregiver to help keep your knees together during this range of motion. Repeat this exercise 15 to 20 times.
Today what we'd like to do is demonstrate the clamshell exercise. It's an exercise that's used to facilitate the gluteus medius muscle, which is really important for pelvic stabilization. Okay? So I'd like to offer you some tips and tricks for this exercise because it's often done improperly. So the first one is, Sarah, when you're lining yourself up to do this exercise, rather than bring your knees up towards your chest, I'd rather see you just extend slightly behind you so that your ankles are in line with your pelvis that's in line with your shoulders. Okay? The second thing I'd like you to do is just bring on your core muscles to elongate through your torso. So if I were ants, I'd be able to march underneath your side here and travel through, if you will. Okay? And the last tip is I'd like you to roll forward through your pelvis so that if I were a light in your belly button, it would be shining down towards the floor rather than, say, across the room. And I'd like you to try to maintain this position while you open through your knees, but keep your ankles together. Hold there, 3, 2, 1, and come down. Good, and I can feel it. I want you to facilitate or get this muscle to do the action. So think about engaging and initiating through the sort of upper back pocket area. And again, hold, and apply a little bit of pressure, just light pressure, and slowly lower. Good. When I start patients with this exercise, I ask them to do 2 sets of 10 daily. Ways that you know that you're fatiguing and not using the gluteus medius muscle is if you feel sort of tension or pain develop in your lateral leg while doing the exercise, or tension and muscle contraction through your hip flexor muscles. So if you're fatiguing, then I ask you to stop, take a break, and then resume the exercise at that point.